It's John with Total Knee Coach, and what I want to introduce for you now is the concept of how you can do your own patellar mobilizations after knee replacement surgery. One of the things that we need to make sure that we're doing in those first few weeks after surgery is getting the kneecap moving properly. Really quick biomechanics lesson. When you go to bend your knee, the kneecap needs to be able to slide down towards your foot. When you straighten the kneecap moves up towards the thigh. That's the way that the kneecap acts as a pulley for the knee as it bends and straightens. One of the things that's going to happen after knee replacement surgery is there's going to be the development of some scar tissue. You can't be cut on and not develop some scar tissue. What we want to be making sure is that as the scar tissue develops, it develops in a way that it has some flexibility and some mobility to it, and that your kneecap, that hinge and pulley that's necessary for the knee to bend and straighten all the way, does not get locked up in that initial phase of healing. So there's going to be some very gentle and easy ways that we can work on moving the kneecap. I'm going to show you a couple of those now. So I want to go ahead and show you a couple things regarding patellar or kneecap mobilization. This is the knee that I actually had surgery on myself, and you can see right in the middle where my incision is. If you've had knee replacement, your incision is going to extend up the thigh and down the leg. The kneecap kind of sits in the middle. Now the anatomy of the kneecap is going to look a little bit like a baseball diamond, where you've got home plate at the bottom. You're going to have kind of an outfield wall at the top. So when we think about the anatomy of that kneecap is going to be about like that. One of the things that we need to make sure that we're doing early on in the rehab is keeping that kneecap mobile. So if you watch me hold my leg really still and put my fingers kind of at where the first base and third base or those outfield walls would be, and I can just move my kneecap back and forth. So just real gentle gliding back and forth in the early stages after knee replacement, especially if all of this down here feels really tight. Should not be putting any stress on the actual incision, but should allow that kneecap to move. So this is something you should definitely be talking with your therapist about and learning with them how you can start just instilling some really nice mobility to the patella without actually rubbing on the incision. So with none of these movements am I going to actually be touching the incision area. My favorite way to mobilize the patella when we talk about a knee that is stiff on the bend, if you watch my kneecap, this is the top of my kneecap right here. When I go to bend my knee, I don't know how well you can see that in the camera, but now my kneecap's all the way down here. When I go to straighten my knee, you can watch that kneecap kind of pull up. When you go and look at your own knee and tighten the knee, it's going to pull that kneecap up as it straightens. When we bend, we need it to go down. If you're having a lot of difficulty with bending your knee, one of the additional strategies you can use for that is to work on helping that kneecap glide down towards the foot. The way I teach people, my patients, to do that is to use the pads on your thumbs on the sides of the incision. If you can see that, I can get really nice on top of the kneecap without putting any pressure on the incision, and I'm not going to press down into my knee, I'm going to push down towards my foot. So I can work on moving that kneecap down towards my foot to help loosen up all of this developing scar tissue and loosen up the end of that quadriceps, help that actual kneecap move down towards the foot. I like to just do some gentle oscillations with that pressure down towards the foot. So and if I start in this position where my kneecap is pretty loose and mobile, my knee's bent about 20 degrees, then what I can do is take my knee and bend it a little bit. Say you can only bend your knee about 90 degrees. You can put your knee at 70 or 80. That kneecap's going to pop up to the top, and we can work on actually mobilizing that kneecap without any pressure on the incision and trying to help that kneecap move down towards the foot. I like to do this before I do my end range stretches and in between the stretches. So then after I work on moving that kneecap down, then I can put the belt on and use a pulley or use my other foot or my hands or however we figured out the best way that you have to be stretching that knee. Incorporating some of those inferior or downward patellar mobilizations in addition to your bending stretches should be helpful. And then lastly, if you're using those patellar mobilizations to work on just keeping things loose while that scar's healing. You're working on sliding it down as you work on improving the bend. The last way that I use this with my patients is to help with the straightening. So especially if you're still getting any pain right above or below the kneecap when you're trying to actively straighten that knee all the way, or if while you're doing your stretches you're still getting any pain here and here, you can still use the exact same grip, except instead of on top of the kneecap, I can come below the kneecap. I'm not going to push down and I'm not on the incision, but from the sides, I'm going to slide that kneecap up as I work on pushing my knee down so that I can help that kneecap slide up in the groove, give myself a better stretch towards getting my knee to straighten all the way. So I hope you found that helpful to understand a little bit better how the kneecap works with the knee and how you can start using these gentle kneecap mobilizations to decrease how tight your scar tissue is going to be and to help improve your ability to bend and straighten your knee. As you have questions about these, you can shoot a comment below. Talk with your therapist about when and how you should be implementing these.